Thank you for tuning in to our best practice series for medical providers working with refugee and immigrant youth and families. This is one video in a larger series hosted by the Trauma and Community Resilience Center at Boston Children's Hospital. Each short video will highlight experts in the fields of medicine and psychology who work with refugee and immigrant youth and families. We're grateful to SAMHSA and the National Child Traumatic Stress Network for their support in making this series happen. In this video, we'll be hearing from Ms. Osob Issa. Ms. Osob Issa is a program coordinator and clinical social worker at the Trauma and Community Resilience Center, where she focuses on community-based participatory research and culturally responsive interventions. She brings extensive experience in delivering clinical and research-based services across diverse settings, including community hospitals and community-based organizations. Ms. Issa has dedicated her career to supporting marginalized populations in accessing mental health services and addressing systemic barriers within the healthcare system. She has provided trauma-informed trainings, consultation, and administrative support to leaders across various sectors, helping them understand the intersectionality of mental health and the need for social and economic equities for the families they serve. Her professional interests focus on reducing mental health disparities in underserved communities and the psychological and social well-being of the children and their families, and promoting necessary adjustments to the provision of how health services are rendered. It's now my pleasure to turn it over to Osob.
Thank you, Heidi. What are signals of care and why do they matter? Signals of care were developed from trauma system therapy and are intentional words and actions that convey safety, care, and support to those with traumatic histories. Refugee and immigrant families often hold medical providers in high regard. Providers can show signals of care by taking a specific culturally sensitive and compassionate actions. In the following slides, I will highlight some concrete steps that can be taken to share signals of care. First, by creating a welcoming environment. We know that the initial interaction is critical for building trust and understanding. It can be the beginning of a long-term relationship or a one-time visit. So asking the families if their concerns have been addressed and met. If not, ask the families about their expectations and hopes. Refugee and immigrant families might distrust institutions and look for signs of genuine care and respect from providers. Some examples of signals of care include making sure that the front staff are attentive and families and clients have access to interpretation services, and to avoid relying on family members for translation. Second, by communicating signals of care, so using nonverbal cues, maintaining open body language, eye contact, and a gentle tone of voice. Validating feelings, reflecting on what the patients share with you, and making sure that you both are on the same page and understanding what's the conversation that's been exchanged or that's taking place. So, for example, I think turning to the patients and the families that's in the room and saying like, that sounds really difficult. Being patient, so allow time for processing and avoid interruption. And third, offering culturally competent care. So educate yourself, learn about the patient's cultural background, values, and common health beliefs. Ask about their preference, traditional remedies or healing practices, dietary restriction, or cultural practices. I cannot tell you how often families are hesitant going to receiving traditional American either medicines or even talking to traditional American doctors, because often that's not what they get used to and they don't think that it would help. So I think just exploring what else would help besides medicines or traditional American approach. Avoid assumptions. Treat each patient as an individual rather than generalizing based on their background. And finally, this is one of my favorite slides, making advocate for equity. So refugee and immigrant families often flee injustice and mistreatment by those in power. Providers must listen actively, advocate for their health and dignity. And addressing disparities to ensure that equitable access to care, regardless of the immigration status or the financial means. Speak up, advocate for policy and support refugee and immigrant health and well-being. And I will, include or conclude and finish by saying that I hope these 4 steps, these 4 concrete steps are helpful and support the work that you're doing with refugee and immigrant families. I think that we know that medical providers, their work is not easy and there's a lot of demand. But I think it's also important to understand that the families make a lot of sacrifice and sometimes canceling multiple jobs that they have to go to or taking multiple transportation to get to the one-time visit. So I think that it's just important to meet them where they are, and I think continue addressing some of the barriers that they're dealing with day to day. Thank you for listening, and I hope again that these tips and strategies are helpful and part of your tool, and you add it to part of your toolbox as you continue to work with families. Thank you.
Thank you, Osob, for sharing your expertise with us. And we thank all of you for watching. If you're interested in learning more, visit our YouTube channel for more videos. The link is in the video description.